Call the meeting to order for Wicomico County Council Legislative Session 2023-20 for October 17th, 2023. Those that like to stand and join us in the Lord's Prayer and Pledge of Allegiance, please do.
Our Father, who art in heaven,
hallowed be thy name.
thy kingdom come, thy will be done, on earth as it is in heaven. And give us this day our daily bread, and forgive us our trespasses, as we forgive those who trespass against us. And lead us not in temptation, but deliver us from evil. Thine is the kingdom, the power, and the glory forever. Amen. To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'd like to ask you to make sure your cell phones are off. In case of any type of an emergency, the evacuation, the exits are at both ends of the hallway out here. We suggest you do not take the elevators. If you need assistance, let us know. Entertain a motion from council to approve the consent agenda.
So moved.
Second?
Second.
Motion second. Any corrections? Discussion? All those in favor say aye.
Aye.
Opposed? Motion's carried. Consent agenda passes. Good morning, Mr. Benson. How are you?
Fine, sir. We're here this morning for a public hearing on legislative bill number 2023-14, an act to amend the purchasing manual section Roman numeral 4E1, professional services, to include computer software developer as a professional service, and purchasing manual section Roman numeral 7, authority to waive competitive bidding. C5 be amended to include administrative work, and paragraph 5B to be added to include an example, existing computer software and associated maintenance and support agreements. And I believe Ms. Kernodle, the purchasing agent, is here if there are any questions.
This time we open the floor for a public hearing on legislative bill number 2023-14. If you have any comments you'd like to make in reference to this legislative bill, come to the podium, please. State your name, your county of residence, and your concerns. That concludes the public hearing on legislative bill number 2023-14. Entertain a motion from council to approve legislative bill 2023-14.
So moved.
Second.
Second.
Any discussion? All those in favor say aye.
Aye.
Opposed? Motion's carried. Legislative bill number 2023-14 passes unanimously. Thank you, Mr. Benson. Good morning, Ms. Hurley.
Good morning, Council President, council members, ladies and gentlemen. Next on the agenda this morning, we have a public hearing on resolution number 133-2023. This is to approve the removal of a forest conservation easement containing 4.99 acres, as well as the on-site relocation of a forest conservation easement containing 33.63 acres. They are located on parcels 223 and 398, shown on tax map 30, owned by Salisbury Ventures, LLC. A public hearing notice was posted on the county's website, and council had a work session on this request on September the 19th. And we have Marilyn Williams here with the Department of Planning and Zoning if there are any questions.
Thank you, Ms. Hurley. At this time, we open the floor for public hearing on resolution number 133-2023. If you have any comments, come to the podium, please. Your name, your county of residence, and your concerns. Morning.
Good morning. My name is Joe White. I'm a Wicomico County resident, and in particular on the east side of the county near this proposal. I'm not against changing the forest conservation. I'm only asking today that you stay this vote, suspend this vote to another meeting, because it was at the work session. The Brown Road where this would exit out of, there just needs to be a more concrete plan for the road improvements for public safety purposes. From the intersection of Zion Road and Brown Road all the way to where Brown Road meets Dagsboro Road, there are, out of the four corners, two on each end, there's 3 blind exits. If we put more traffic here, we're going to have more people taking greater risk, pulling out onto people who are unsuspecting. Again, I'm not against doing this, but and I like progress in the county. I want to see us be able to have it. But East Naylor Mill Road was built for commercial and expansion. Brown Road just is not ready for it. So we got like stage 2 happening before stage 1 has happened. And as someone who drives through there multiple directions, coming down Zion Road, coming down Dagsboro Road, coming through Brown Road, all different directions, I'm going to have to encounter people who are taking greater chances to get out of an intersection that they already can't see out of. So, and one other point of thought, if you live over in the Pittsville area or the Gumboro area, which I know is just across the line, but if you live out that way and you're at the mall, right now you have to either exit out Zion Road and go down through the cut-throughs like Morrison Road where I live, or you have to go down Dagsboro Road down the back way. If you're at, say, Vernon Powell, there's now going to be an option to cut through the Parsons Lake neighborhood, which is not going to be designed for this, to cut through to exit out Brown Road without having to hit traffic lights. I just don't think enough planning's been done. Again, the project is worthwhile. It's great that we have new people coming in, but there's just other work that needs to be done before we start dumping traffic out there.
Mr. White, any other public comments? Seeing none, that concludes the public hearing on resolution number 133-2023. Entertain a motion from council to approve resolution 133-2023. Second? Do we have a second? Resolution number 133-2023 fails due to the fact that we do not have a second on the motion. Okay. Ms. Searle?
Okay, next is the, next is the submission of 3 new appointments to the Social Services Advisory Board, and we have Mr. Bunky Luffman here, our Director of Administration, and Roy C. Brewington, who is the Director of the Department of Social Services.
Morning, gentlemen.
Good morning, Council President. When this was going to be on the agenda, I asked Roy if he could come. That way, I figured he could both talk about these appointments and perhaps, if with the council's indulgence, maybe give a little update from his perspective. So,
Sure.
Glad to have you here.
Thank you. It's wonderful being here. And forgive me, should I stand or?
Yeah, you're fine right where you are.
Just wanted to follow protocol.
No, you're doing great. You're doing great.
So I am not going to presume to educate this fine body on what the Department of Social Services does. I know you guys are intimately familiar with what we do. What I will tell you is why the advisory board is important to us. Wicomico County has 104,000 residents, I believe. I have an agency of 160 staff. So while our job is to ensure the safety and security, excuse me, families and children and vulnerable adults in the county, we have limited resources with which to do that. That's where the advisory board comes in. They are our connective tissue to the community that we serve. The people that serve on the advisory board advise me on problems that I may not see with the connections that I have to the community. They bring ideas to us about things that they feel may need to be addressed. And most importantly, they help guide the way we implement human services policy in the county. That's very important to us. I don't presume to know everything. As most of you know, I'm a social worker. My master's degree is in public administration, so I'm very big on the organizational and policy side of it. But I need people to tell me the things that I don't know, and that's where the advisory board comes in.
Any questions from anyone? Okay. I appreciate that. Ms. Sterling?
Okay, so we have Resolution 134-2023. This is confirming the appointment of Timothy R. Bosman to serve as a member of the Department of Social Services Advisory Board.
Motion from council to approve resolution 134-2023.
So moved.
Second.
Second.
Discussion? All those in favor say aye.
Aye.
Opposed? Motion's carried. Resolution passes unanimously.
Next is Resolution 135-2023, confirming the appointment of Tiffany Tatum to serve as a member of the Department of Social Services Advisory Board.
Entertain a motion from council to approve resolution
So moved.
135-2023. We have a motion. Second.
Second.
Any discussion? All those in favor of resolution 135-2023 say aye.
Aye.
Opposed? Motion's carried. Resolution passes unanimously.
Next is Resolution Number 136-2023, confirming the appointment of Christy C. Richardson to serve as a member of the Department of Social Services Advisory Board.
Entertain a motion from council, entertain a motion to approve from council to approve resolution 136-2023. Second.
Second.
Any discussion? All those in favor say aye.
Aye.
Opposed? Motion's carried. Resolution passes unanimously. Thank you, Mr. Bruin. Appreciate
Thank
it.
you, sir.
Mr. President, that is all I have.
Thank you. This time, I entertain a motion to adjourn from legislative session so that we can convene as the local Board of Health. Need a motion.
So moved.
Second?
Second.
All those in favor?
Aye.
Legislative session is temporarily adjourned so that we can go into session as the local Board of Health. First item we have on the agenda, or the only item we have on the agenda is the report for the health of the county with Mr. Matthew McConaughey. Good to have you.
Good morning, council members. How are you doing today?
Doing fine,
Morning.
thank you.
I brought Christina Gray, my epidemiologist, as you all had invited her at the last Board of Health update. So I have provided to you today with our brief overview, if you would like to run through what we'll be talking about, and also provide it for your briefing packet to Ms. Hurley. We will start with the septic update. As you can see, we are still in a deadlock process, waiting for about 18 applicants from the backlog to still receive contact to move forward with their process. Those were ones that were backlogged from January 7th, 2023 and previous. Our current, we have made significant steps to keep up with the ongoing applications for replacements, new constructions, and tank onlys. We have recently hired a landside supervisor, bringing us up to 4 full-time staff on landside, so we expect to have a pickup in our pace on what we do for permitting, and also doing preparative work for our land evaluations, given that we have a wet season this upcoming season.
How far out are you on doing these inspections, say like reevaluations and perks?
For land evaluations, we currently have 138 overall applications, and 79 of those have not received the work. 23 have received work and are ready to go once a wet season is in place. We're going to start the work to make sure that pretty much all 138 are ready for this upcoming wet season.
So how far back are you dated back to people?
2019.
So you still have some out there that's been, applications been in 4 years?
Yes, because I believe for the past 3 years we have not entered a wet season.
So what happens if we never have a wet season? Does this mean these people can never develop their property?
Based on the GRP, we would have to go back into that, talk with MDE to see what we can do to properly assess, because really it's in the best interest that we have a wet season, because it protects the groundwater, it protects the water that they consume, and it's a public health safety standard. We will have to go in to see and have communications with MDE, the county, to see what we can do progressing forward. But these seasons happen. This is not the first time that a county has gone without for a duration of time, but a wet season will eventually come.
I guess what I would think is, how about if it doesn't? But, you know, if you have permitting out there that's been waiting 4 years, has anybody worked with MDE to try to see what they could do about these? I mean, we got people out there apparently 4 years out that's trying to build a home or build a home and sell a home. So we're holding businesses up or holding people up from being able to build a home on their property. So there's not been any discussion with MDE
There
as of
has,
yet?
but it's been waiting, and we just have to wait on the wet season. That's what's in COMAR, that's what's in code. So it would have to be a legislative action for us to alter what we do in that process.
It's just, I guess on that note, could they put in a holding tank? Is that another available option? I mean, outside
A
of
holding
septic?
tank is an option of last resort. It is not issued to an area that would be just for a land evaluation. All other avenues would have to be approached before a holding tank is considered. And that's based off of COMAR regs.
When you mention legislative action, with us or on the state level?
Probably on the state level, because it's COMAR that regulates how we operate for landside evaluations.
Could we maybe write like a letter of support or something to encourage them to have some sort of special exception for us?
That is an option, to reach out to either MDE, state legislature, about the need to have a contingency option. I know things have been discussed, but with this, I know it's a long period, but there have been longer periods across the state that counties have gone without wet seasons.
I just think it's unacceptable to hold up a owner of a property for 4 years. I mean, there's got to be something that we can do different. James, it's a good idea to write a letter in support.
I think this underscores why it's so important for us to advance county water and sewer.
County water and sewer is not going to end up on the north side of Willards or down on the south side of Powellville, and that's not going to be any help to those people trying to build in a rural area that county water and sewer will never serve. So, county water and sewer is a great idea as far as if it's close enough to the municipalities to be served, but, most of these folks are just trying to do this, live in a rural area, so.
Yeah, the challenge is we've got a tsunami of failing septic systems that are coming our way that were built more than 30, sometimes 40 years ago. Many of them not checked. They're not required, as far as I know, to actually, the homeowner is not required to inspect it, required to do so. So what we now have, of course, there are a lot of folks who are going to sell their homes, and they've got salt water in their water, and they've got a septic that doesn't work. And that is a dead property, essentially. So until we come up with better options, or actually have something that we know works, we're in a really tough situation. And my heart goes out to the folks who, bought their property, thought that they could move in a direction, and 4, 5, 7 years later, they're still waiting. That's challenging, but this is the reality of the situation. You don't want to be drinking what you are flushing down the toilet.
Yes, it's all public safety concern, and that's our base issue. We do not want to permit or give precedent to something when in turn it's our responsibility to ensure the safety of that individual household and not have them drinking their own runoff.
In your report, I guess what we should be paying attention to most of all is the open applications, correct?
Correct. Those are the current ones that we have, and we can probably get a column on the ones being currently worked as well. Because, yes, you see 70 open applications. That doesn't mean that work hasn't been done on them. It's just a process to receive the drawings, designs, and the approval of those applications for the installation of these septics.
There's 17 open applications, is that right? Did you say 70?
79.
I'm
looking at the updating on septic permitting.
Yes, so
I see where you are.
On the front side, those are the ones from January 17th, 23. Prior to that, we have 18 current open applications still. Of those, we have contacted and done work on all. We are waiting on response back from the landowners. There's various reasons. Either they stopped the process.
There's only one that stopped, right? There was only one that stopped.
I don't have that on this current sheet.
We had 5.
5.
That were completed because the owner requested to close.
Yeah.
Okay.
Yeah, first column.
Oh, there it is. Okay.
I guess the question I would have is, with the circuit riders and the expenses that we've accepted to pay circuit riders with MES, are we really accomplishing anything if it's a wet season? I mean, I'm not sure what these individuals may or may not have done in addition to the individuals who are working on staff.
So that funding came from unfunded positions at our health department. It wasn't, it was just a reallocation of those funds to provide for that service. We still do have funds that we can bring them in, especially when we're in this preparing for land evaluations. We can bring them out to do site prep work. And that way we can make sure that we have more of these parcels ready for work and for readings of piezometers and things of that nature once a wet season does come.
I guess I've been listening to all the reasoning behind why things can't get done due to wet season, no wet season, and I've heard in the past that we can't do perks because it's too wet. So where does that line drawn? When it's too wet to do a perk or no wet season?
So the too wet, I don't think would be the issue. What we do is we do an auger test hole, or you dig a pit, and you can see the delineation between the sediment levels, and you're looking for like a rust sample, pretty much rust colored soil. That's where you can tell where the high water mark's at, and that's based off of your auger drilling. What we then do is we put in a piezometer that allows us to read the level that the water rises to and fluctuates throughout that wet season to know how high the water table rises at that location. And you need at least 2 feet of separation between the drain field and the water table. As I said, we hired our new landside supervisor, longtime local environmental health specialist, so we're very happy to have him on board and to start progressing our work. Additionally, Mr. Hastings, last meeting you asked about having native switchgrass over the drain fields. It's not a recommended practice just because it's a deep-rooted native grass species, which can have the likelihood or potential to get into the pipe systems of the drain fields, which would cause a malfunction in the system. That's all I have regarding our environmental health side. Does anybody have any additional questions regarding that? Okay. I'm going to turn it over and let Christina give a more statistical update about our current status.
I promise this will be painless. So good morning. I appreciate the invitation. I hopefully have some good news for you on a lot of our population health fronts. So what you see in front of you are just the highlights. Of course, if you have any questions after the meeting, definitely has my contact information. So. First and foremost, we have hit respiratory season. When we, talk respiratory conditions, we're talking COVID, RSV, and influenza primarily. We had a slow summer for COVID. This was different than what we saw in 2022, so this was good. So far, since the pandemic began, we've had over 25,600 cases of COVID and 373 deaths since March of 2020. What we saw again with that slow summer, our case rate was very low. Schools went back into session and we kind of started to creep up, but really just above the 5 cases per 100,000 resident case rate. Stayed there for about a month, but as of the update last week, we are now below that threshold again. So this is very different than what we saw this time last year.
That's based upon individuals choosing to report, correct?
Yes, so these are based on confirmed lab reports that are received. Yes, so they would be tested by PCR. Yeah, correct. Not the rapid test would be that person reporting that on their own and not counted in these numbers. We do hear, have a report from Tidal Health on a daily basis still. Our hospitalizations for COVID have remained low. We do have a new vaccine for this season. This is a monovalent COVID vaccine. So again, going away from the bivalent, which was recommended last season. Right now, the recommendation is everyone 5 years and older to receive 1 dose of this vaccine. And it is based on the variant that we saw for a huge part of the year. So hopefully a continued protection with that. As far as influenza, our new flu surveillance season, the typical season starts in October. I will say this past year, because of the heightened case rates from last season, the Maryland Department of Health continued post-season surveillance. So we did see that we didn't have any summer activity, but now we go into the official season of reporting. Again, good news, our flu hospitalizations have been minimal at the hospital. We have a flu vaccine. It is recommended for all persons 6 months of age or older who do not have any contraindications. And last year, we had about 1 in 4 residents in the county that did choose to get a flu vaccine. As far as RSV, again, it's a good broken record, so good news. This time last year, we had 110 RSV hospitalizations throughout the state. Last week, we had 14. So comparing, the apples to apples this time, last year, we are in a much better place. What we saw was that curve for RSV hospitalizations peaked in late October, so we're almost there. We're in about the 3rd week here, and we're not seeing anything close to the 2022 rise, so good news there. We do have 2 new preventative tools for RSV, a traditional vaccine and a monoclonal antibody. First, the vaccine is approved for use in people 60 years and older. A lot of times RSV is viewed as a pediatric disease, and rightfully so because of the impact in infants and children. But we do have several older adults that are affected by this every year, including up to 100,000 cases throughout the that are hospitalized in older adults throughout the country, and even up to 10,000 deaths from RSV infection each year. As far as the monoclonal antibody, this is what is approved now for use in infants younger than the age of 8 months of age, and then some children even older than that if they have a chronic risk factor or they're immunocompromised in any way. Just as a reminder, RSV is a leading cause of hospitalization among infants, so this is an important new tool that we have for this season. But if for some reason the infant is unable to receive this, an alternative is providing the vaccine for pregnant mothers in later stages of pregnancy to kind of transfer that level of immunity to the baby. Okay, any questions on respiratory? So moving into some behavioral health, so this is inclusive, of course, of mental health and overdose. I did reference the meeting minutes from the June Board of Health and do have some follow-ups based on that. So President Cannon had some questions about the impact of xylazine in Wicomico County. So as a reminder, this is also known as tranq is a word for that. It's a sedative that's used in veterinary medicine, but it's being used to cut opioids. It's inexpensive, and the xylazine, it's believed, is able to extend the high or the effect of the opioid. So we're seeing this more and more. But to get to your specific question, President Cannon, there is actually no county level specific data on xylazine overdoses at this point. Why that is many times, especially with overdose deaths, it's being used in tandem with fentanyl. So fentanyl is listed as the cause of death, even when xylazine is a contributing factor. So we know that this is an area that we will have to start really digging down deeper to see how many of these deaths truly where xylazine was playing a part.
Are there, with those type of deaths, I'm going to assume most of them are unattended. A lot of them may be. Wouldn't the autopsy require the specifics of those details?
It depends on what is screened at toxicology for us as on the data side to see which drugs were involved at the time of death. So because this is kind of newer on scene, it's not something that's regularly reported. So we're trying to gauge that moving forward. But certainly fentanyl is the key driver in most of those deaths.
Okay.
However, our opioid coordinator did have Washington Baltimore HIDA do a brief presentation recently. Nationally, they're seeing that, 80% of xylazine positive samples also test positive for fentanyl, doing in their work. I talked about it being used to cut. What we are seeing, though, is some characteristic markers, so open sores, wounds, and abscesses that result from when xylazine is being used. So in terms of the activities at the health department, our academic detailer who goes around to our healthcare providers providing information on opioids and prevention is now including information on wound care because of this. So just to be aware if providers are seeing these particular types of wounds. We have some rack cards, so some general information now on what xylazine is, as well as test strips in our harm reduction program. Other follow-ups that I saw, Councilman Hastings, I believe, asked about adult suicide trends. In 2021, it was the 11th leading cause of death here in the county, unfortunately. What we see is that these emergency department encounters for suicide and self-harm continue to be driven by young adults, and 50% of those encounters in 2021 were between the ages of 10 and 24 years of age. So it's very, keeping an eye on those trends among the youth will be important. As far as suicide deaths, these are overwhelmingly among our male residents, 95% in the 3-year period from 2019 to 2021. But when we look at emergency department encounters for this same outcome, it is about 50-50. Councilman Hastings, I also saw a note about following up on youth alcohol trends. I believe our last Board of Health, the most recent youth risk behavior survey was released. So some great trends are way positive here. So we see when you compare the 2013 to 2021 YRBS, statistically significant decreases across the board for high school students in the county for drinking before the age of 13, being a current user of alcohol, and students that are binge drinking alcohol.
Question for you.
Yeah.
Well, first of all, I guess I'm trying to get an understanding of how these are calculated and to what degree the death is attributed for death. My sister-in-law, her childhood best friend, he chose to kill himself through alcohol. He knew he was going to do it. It was alcohol abuse, killed his liver. He was very clear about that. So that was a sad situation. I'm assuming that death was attributed as liver disease or something along those lines. Had another friend who, of course, many of the folks in here know that his family, he drank himself pretty bad and then got in a car accident and killed himself. Is that then vehicular death, right? Is that how that's calculated? But I'm trying to get a better understanding. I was looking at some of the statistics last night when I was reading through, and just trying to get a better understanding of how that's calculated.
Sure, absolutely. So it can be subjective at times. This is left to the office of the chief medical examiner a lot of times when autopsies involved, et cetera. However, there are many variables on a death certificate. So in that last scenario, that would be considered typically the underlying cause of death being the motor vehicle accident and the injuries related to that. However, if there was a toxicology or something else done related because there was suspicion, that would hopefully be listed as another cause on the death certificate. So in the data that we see. So yes, it can be subjective at times, but the data, you drill down a little bit, it should be there.
Thank you.
Okay. In terms of overdoses, we, again, unfortunately, are still very behind getting our data here at the county level from the state Vital Statistics Administration. However, that seems to be opening up. They're prioritizing getting that data out to us. So the latest that I have is what's preliminary from the Opioid Operational Command Center, or OOC. They provide provisional 12-month rolling year data. So when you compare the 12-month period ending in May of 2022 to that 12-month period of May of 2023, we actually had a decrease of about 13% fatal overdoses in that time period, down to 39 from 45. And again, looking at the hospital encounter data, down about 4% for non-fatal opioid-related encounters in that period. We have done a lot of work. We just wrapped up Go Purple Month. A lot of recovery events occurred this month, or in the month of September. We had our Overdose Awareness Day at Winter Place, our Go Purple kickoff at the Shorebirds, a new event, Rock for Recovery, partnering with Oak Ridge Baptist Church, which was very successful. Our second year doing the Shatter the Stigma Walk with Warwick Community College, and an all-month-long interview clothing drive for Recovery Month. So a lot of different things the health department either led or partnered with in the community for overdose. Not a lot new in terms of cancer data, but it is October. It's Breast Cancer Awareness Month, so I figured I'd give a few data points here. We haven't had much change statistically in the number of new cases in the past 5 years, kind of hovering at that 131 cases per 100,000 female residents. We're about the middle of the pack in the state. So we have the 11th highest incident rate for breast cancer. So not the worst, not the best, kind of in the middle there. The good news here, though, is even though that we have new cases, we are hopefully catching them earlier because our mortality rate has declined statistically during that same 5-year time period. So even with new cases, of course, the goal is to still catch them early with screening rates. And at the last risk factor survey among adults, we had 78% of Wicomico County women that 40 years and older that self-reported being up to date with mammogram screenings, and 93% of women in the county having at least one mammogram at some point. Okay. Moving kind of out of population health into internal data for our health department. We recently, in August, were reaccredited by the Public Health Accreditation Board for another 5 years, so very proud to report that. And one of the domain areas, there are 10 domain areas, one of them is focused heavily on performance management and quality improvement for our agency. The board has an expectation of us that we are communicating this data to our Board of Health. So this is our first try at this. It's a newer thing for our agency to have our performance management system. We launched midway through FY22 and just completed FY23, so we figured this would be a good time to start talking about this. It's important to note, and this was one of the attachments that was sent previously, but our high-level performance management dashboard. Not a personnel management system. We have a wonderful personnel office that handles all this. So this is how we're identifying areas in our programs where we can lead to improvements that eventually give us better population health outcomes. We have several on the left-hand side that are tied directly to the programmatic work that our programs are doing at the agency, but also some higher level measures that are tied to our agency plans. And so some brief 2023 successes. 2 of every 3 of our measures this year hit their targets for FY23. We saw improvements with the number of mental health clients that we serve, having an up-to-date depression screening. ARES assessments that were completed in 30 days, that compliance increased immensely. The number of timely MA transportation recertifications increased, as well as the number of people we were able to train in the community on mental health first aid, which is becoming an important tool, again, for a lot of those health outcomes we just talked about. But the purpose of this is to look for areas of improvement. So we actually got our first quality improvement project from a program and not from our kind of agency suggestion. We saw in FY23 that our LBHA, they were providing Narcan trainings to the people in the community. They had a goal of reaching 300 Narcan trainings to people with social experience. These are folks that are at higher risk, maybe family members of those who have overdosed or people that are active users. They missed their goal, fell short, I think around 237 or so. So we said, hey, let's see what we can do in terms of getting the numbers up. And we have a wonderful new program with Salisbury Fire Department called Leave Behind, where they're able to leave behind do Narcan trainings when responding on site to overdose events. So we're hopeful while it's not required to provide this training, that we are going to get that in the hands of those more at risk for overdose.
And then leading into strategic planning and our annual report, our strategic plan, we do a process every 5 years to update it. We recently just published our 23 to 27 report. This is a multi-stage process, including a SWOT analysis with all agency staff and our local health improvement coalition. And we just recently published our 23 annual report, which was provided as well. Our priority focus areas, one is community health improvement, and it has 3 priorities: access and health equality, behavioral health, and chronic disease. In regards to access and health equality, increase the number of community health workers employed at our health department, and we have successfully done that over this year. Over 90% of new employees are trained in equal access compliance within 6 months of hire. And our MCHIP program processed over 3,200 Medicaid applicants over the past year. Behavioral health, 3 of every 4 intensive outpatient clients successfully completed the program. 63.5% of COAT team clients have been linked to treatment, and of those, 89% are still in recovery 6 months after the first encounter with our COAT program, which I believe is a huge success. We've had 108 individuals trained in mental health first aid and done 27 academic detailing. Our chronic disease and wellness, we exceeded our screening goals for breast and cervical cancers, as well as colon cancer. And our current diabetes prevention program cohort has retained 15 programs, which is very good and makes us in compliance for CDC continued recognition. Our priority 2 is communication. We have both an internal and external communication plan. For our internal, we completed an assessment in summer of '23, and we have constructed and published our internal plan to ease communication throughout our organization. Externally, we continued with growth on social media, expanding our LEP for Spanish and Haitian Creole, as well as translation for vital documents into Portuguese. Priority 3, our workforce. We're at the point where about 1 in 5 health department employees could retire in the next 5 years. So we're working on succession planning and building up our organization. We launched our Workforce Development Committee, and it's tasked with creating and implementing a plan based on our assessed needs. And we're working on initiatives to strengthen professional development with the core competencies of public health. Our final priority 4, technology, technical assistance provided by Christina to several agencies, programs to improve data management efficiency, transitioning from manual data collection to electronic. And we have re-imaged 185 systems at the local health department after the system outage. Just some points that I would like to go back on throughout Christina's presentation. With COVID vaccination, this is now commercialized at the federal level, meaning that you have to pay for your vaccines. Most insurances do cover that. For those that are uninsured or underinsured, there's a bridge access program where covered vaccines is being provided to pharmacies, FQHCs, and local health departments. So we have the resources to be able to provide vaccinations for those that are uninsured or underinsured. We will have a supply of vaccine at the local health department as well. We are currently awaiting that allocation and shipment. And that brings us to the completion of our report. I just have one topic that I'd like to bring up for your all's consideration. There has been some movement around the state of expanding of Board of Health, and I wanted to bring it up to you all if you thought that maybe the addition of some ex officio members potentially in areas that aren't covered by the local health department, maybe veterinary, ophthalmology, pediatricians, general practitioners, anything of that regard may be of interest to you to get a more holistic approach or opinion of the health of the county. That's up for consideration. I know Frederick County just recently, I believe, voted on that measure, and I can provide that information to you all if you're interested.
Do you mind repeating that again? Like, not the whole thing, just the last part.
So I was just wondering if you all would be interested in, I know it would have to be a amendment to the charter, I believe, but some of the counties across Maryland have expanded their Board of Health, just like here it consists of the council members, but they've added some ex officio members, so non-voting members, to the Board of Health, and just off the top of my head, you could consider veterinary professionals, ophthalmologists, general practitioners, pediatricians. That way, it's because we don't have that scope of practice at the health department, so you could receive a more comprehensive health of the community, or you could have questions focused to those areas and gain input besides the sole contributions of the health department. That was just a recommendation for you all to consider.
I have a question. How do you address kidney disease? Do you all address kidney disease? I don't see it, in your report.
Do you mean in the reporting of data or the healthcare side? Because
Well, the healthcare, the reason why I brought that up, since we're a rural area, I had a situation with a lady lived in Nanacoke, and she didn't have transportation to get to her dialysis. And she didn't qualify for the medical transportation because she had Medicare. So we do have seniors, and we are a rural area, that need to get to the dialysis, and I didn't know if some way down the line that you could have satellite places where they could get their dialysis, where they wouldn't have to worry about getting to their dialysis. It would cost her $60 a day to get to dialysis.
this is actually not the first time I've heard of the gap in transportation services for older adults trying to receive those essential services. I actually had a phone call that ended up in my office on accident, but I was able to connect them to resources with our hospital system that could provide some transportation where our MA transportation could not. So there are some other resources out there, but it definitely is a gap in service at this time.
As a focus point of our organization and outreach, it's not one of our top priorities, but we can look about seeing what we can do to address this gap and to do more education on the need of dialysis and the need for transportation.
And I think when you do your statistics, you should maybe contact the people that do dialysis to see how many patients that you have, so you'll know where the need is. I mean, you know, some people qualify for medical assistance and some people do not. And then some people may not choose to even get dialysis and eventually, you know, die of kidney disease.
You know, we have a growing population of older adults.
I know.
By the nature of, you know, our baby boomers getting older. So this is going to be something that the health department will certainly focus on.
Yeah.
Mr. McConaughey, I think you were looking from the council for some type of a consensus in regards to the additional of ex officio members. Is that correct?
Yes, that is. If you want to consider it, take time. If you want me to provide additional information, I would just like you all to consider that option, as it would just give you all more of a support base if you need to make any decisions or like more information regarding the health of the community.
I think at face value, it seems like an excellent idea. Everybody okay with
Yes.
that?
Would that include maybe somebody that knows about how to
perks done and things like that.
You know about what?
Getting perks done and land evaluation and stuff like that.
Well, we would certainly leave that up to the
Well, I mean,
director.
you want an officio person on the council or to work with the council to have a better understanding. That seems to be where one of the biggest problems are right now.
It certainly wouldn't hurt if that was part of the appointments that you were to make, certainly. Someone that's experienced in that field, like I think what Joe may be talking about, it'd be really good possibly for you to get a firsthand evaluation from the developers or for the installers. Is that what you were referencing?
That's what I'm referencing.
Maybe put an ex officio member on there who is an installer or something firsthand in the field, if that's the direction that you were looking for.
If that's, I believe my role on the Board of Health, I'm technically, I guess, the chair and secretary, and you all are the voting members of the organization. So you would, I could present potential applicants to you all for the approval of.
That'd be fine. But what I would suggest is go through the executive's office, and then you could initiate the recommendation, however you choose to do it, and put it exactly how it fits for you, and then it would come to the council as a secondary measure for approval. That would be, but again, so that you're not spinning your wheels.
Yeah.
I think we have a consensus here that would be a good idea, great idea.
Okay.
Josh?
And just to add on to that, I saw you were going through the strategic planning and just thinking through there, you know, on behalf of the council, I serve on the Commission on Aging. Just want to make sure that we're meeting the needs of our seniors, which of course is everything from septic issues to aging in place to, you know, all of those issues, transportation, but maybe the head of the Commission on Aging, that president could rotate on and off. That might be a consideration, but
Okay.
yeah, I appreciate what you all are doing.
No.
I had a couple of questions I did want to ask you. It's a great report, by the way. Very thorough, very easy to understand, really comprehensive. In your accounts receivable, there was a notation of $7 million. I just didn't know if that was standard. Is that usually Medicare, Medicaid reimbursements, or I'm not sure what page it was on.
Oh, on the annual report.
Yes.
Yeah, sorry. We provided a lot of documentation.
Okay.
Let's see. Okay, that's that one here.
It's on page 26 in the report.
Okay.
And if you
Yeah,
don't have the answer now, that's fine. It's just curiosity.
I would say that's probably about par for the course about what we process and allocate it in regards to collections of fee-for-service programming through it historically. We operate five or six fee-for-service programs, dental, DDA, PRP, target case management, mental health and addictions, and our healthy families programming.
Yeah, the other question I had was you were mentioning in this report the fact that language access services, that you're bringing in new interpreters, and there's an 85% increase in the community in reference to Haitian, Creole, Spanish. Is the state of Maryland addressing that as well, especially, you know, for this region? Because I think we probably are experiencing a larger influx.
Yes. So in regards to what's required, I guess, federally through Title VI and Title IX, it's based on the percentage that the organization sees. So in reality, across the state, it's probably a low percentage and doesn't meet the threshold. Here internally, though, we do meet that threshold to provide the information in the native language for those recipients, so Spanish, Haitian, and Creole, and we're even starting to expand for Portuguese as well. So we do everything we can here locally. There is no state vendor as far as interpretation services goes, but we have a contract with Language Line. We've expanded out to another organization that provides on-demand service and video conferencing, especially, which is beneficial for our ASL clients as well.
Understanding the fact you're sort of a hybrid agency between local, county, and state.
Yeah.
The reason I asked that is because I didn't know if there was any need for the council to advocate for this.
It would-
Or Eastern Shore delegation to try to see if they feel that there's a short fund in funding for this.
It would be a benefit. The state is very cooperative. I know when House Bill 1030 came out about the Medicare expansion for undocumented, I just said, would you please have this provided in Haitian Creole and Portuguese, and they sent the information right to us. So if there is information that actually comes from the state, they're very easy to work with getting that information.
If the increase in interpreters and things like this to take a toll on your resources, you can always reach out to us to also maybe reach out to the Eastern Shore delegation and try to.
Well, we would appreciate that. Any support we can get to get more on-hand interpreters would be a benefit, because that does cut down on our costs for language access services, because we can provide that in-house instead of paying for language access lines or anything in that regard.
Yeah, specifically, if we could have a reduced dependency on using the phone language line and have in-person support would be very beneficial as this population or multiple populations grows.
I have a Haitian Community Center right downtown. I'll give you the card, and they work with the Haitian community.
Yes.
Reverend Toussaint.
Yeah.
You're familiar with him?
Yes.
Okay. Because they would be able to help you with the interpretations.
And they do. They provide a good amount of support for us and
Okay.
clients that seek care.
All right. Mm-hmm.
I only had one more question, because, kind of in light of what Shani discussed as far as the kidney dialysis issue. I know that the health department used to have contract with Short Transit, the Tri-County Council, some time ago. And I guess it may have been a cost-cutting measure, whereas the health department separated from that arrangement. But I didn't know if that may possibly still be another option in your search for trying to find more accessible transportation for these individuals. It may be better to do one-on-one. I'm not quite sure how.
So I'm not probably sure of everything that occurred with that. I do know that we do have to routinely submit our RFPs out for bid, and we usually go off of cost-benefit analysis of what providers we accept for our MA transportation. We're currently in that process right now of having open bids for providers for MA transportation, and it could have been some cost reductions or funding reductions that limited and restricted who we can provide service to.
They may be transitioning, though, to smaller vehicles, which may be something that's more appealing to whatever your numbers might require.
Okay, and that's something that I will definitely bring back and we can look into.
Okay. Just letting you know, you don't have to report back to us. I'm just letting you know. It's
appreciated.
Yeah, okay. Any other questions? No? So, any other comments you'd like to make? No?
I just appreciate you all's time and willingness to work with us. If there's anything you all ever need, please don't hesitate to reach out.
Sounds good. Thank you very much for being here.
Thank you.
Appreciate it. Entertain a motion from council to adjourn from the local board of health and reconvene into legislative session.
So moved.
Second? All those in favor?
Aye.
Opposed? Motion's carried. Next item on the agenda, we have Anjali Chattel. Good morning.
President.
Yes.
I just want to point out that our agenda currently says that we will be reconvening in legislative session at 3 o'clock today for the bond award. I have been informed by the finance director that that will actually take place at 2 p.m. today rather than the 3 p.m. or shortly thereafter. So it might be like 2:10, but the intent is for council to reconvene at 2 o'clock today.
And from what I understand, it's about a 5-minute process, 10-minute process?
Right, it will not take long.
Okay, thank you. Good morning.
Morning, President Cannon and Council. Today, I am presenting resolution number 137-2023, adopting the annual audit plan for fiscal year ending June 30th, 2024.
Entertain a motion for council to approve resolution 137, 2023.
So moved.
Second.
That's good. Thank you.
Okay. So the plan has 11 areas. 9 of them are actual audits, and then 2 of them are not. The audit plan is based on a risk assessment that I did, a shortened risk assessment, but I did do a risk assessment, as well as the plans that were not done in the prior fiscal year. And then the risk assessment is one of the non-audit projects, which is required by my standards, our standards and per the code, and then a self-assessment for the internal audit office.
And your audit plan, I guess for the public's knowledge, if you would just explain the 11, just the title of the 11 projects that you're looking at.
Okay, so the audits are the bank reconciliation audit, budget review and audit, cell phone audit, leave time audit, fuel audit, information technology infrastructure audit, purchase card audit, sick pool audit, and workplace culture audit follow-up. And then the non-audits are the risk assessment project and the internal audit self-assessment.
Does anyone have any questions in reference to the 11 projects?
How long is it? How long do you think this would take for the whole audit?
About a fiscal year, if there's no sickness and no, and no other follow-ups or other tasks, but I know that's going to happen. And the standard practice is that anything that's not done in a current fiscal year is then added to the next year. So I don't actually, in a perfect world, this could be completed. Likely, it will not be completed. And a lot of the background in my objectives and scopes for each of the audits that are also attached, there's, what I will review. And I've started actually doing some of the review things of things that are public that I don't actually have to inquire with anybody. So I've kind of started, but not actually asking departments for anything, not actually testing anything. So I haven't actually done like the intense work, but I've kind of started this preliminary. So we are in a shortened year. And again, this is the perfect world plan, so there will be some carryover, but I hope not too much. And if I get an intern in the spring, and we'll discuss that later in a closed session, but then that could also help in getting the plan done in the entire fiscal year.
2 questions I had, or 2 areas. So first of all, the information technology infrastructure audit. I'm especially interested in this. I know, about 2 years ago, it was basically the framing was it's only a matter of time before your county government, your local government, if you're not completely on top of it, it's only a matter of time before you're facing ransom issues. So I don't know how you go about doing that, and I was reading through, and I'm still not quite sure how that's going to work, but I appreciate a deep dive as much as possible into that area because I do feel like Wicomico County is more vulnerable than it probably realizes. There's no need to comment on that if you don't want.
Well, I can.
Yeah, go for it.
I've already started reviewing the National Institute of Standards and Technologies. I do have a master's in information systems, so I kind of know some of what's happening here. I've already started doing the risk reviews from various data sources for how much it costs different organizations and governments, our governments that have been attacked in Maryland. And I'm actually going to be proposing at a later date, though, that the Wicomico County Code be updated to actually include a section for information technology. And there are other county charters that have that. And I'll when I do the full report. But that's one of those areas that I've already started doing the deep dive of the background.
I was really happy to see that, and of course, with your background, that's really fantastic. I know Maryland Association of Counties was making a big deal of this. So I don't know if you interface with them much, but certainly they probably have some good guidance and thoughts on how to do a deep dive. The last thing I'll say is number 9 on here was the workplace culture audit and follow-up. For that one, you were going to looking into the turnover among many other things. Is that broken down by department? Or are we going to be able to get a better idea of, okay, under this area, more people are leaving, that might then clue us into adjust salaries or other kind of, or take a deeper dive in understanding of the culture itself. Anything you want to say more about that?
On that, no, because I haven't actually started, I feel like this is the go day, and so I haven't actually started the go of going to the departments and actually finding the data that I can get from them. So looking at the public records, there's not that much. So I'm really going to have to go into the departments and to HR and also into Munis and get into how low I can go into or how deep I can go into the numbers for the different types of turnover.
Okay, thank you very much.
I have a question. Yes, Joe.
On purchase card or audit, explain to me how you go about that. How deep does that go? Do you look at what's being bought with the purchase cards, or are you just looking at, what's being paid and, does it add up, or how?
So the concerns that have been brought to my attention are largely about split purchasing from different departments and so forth. So for the purchase card audit, my plan is it's sort of a tie-in, so there's a trilogy of sorts with the audits this year, the bank reconciliation, the purchase audit, and the budget review audit. So if I don't catch things that I've sort of been told are possibly happening or have happened, that I'll catch it in one of the others in that area. But for if I do searches on specific vendors, specific objects, and these will be separate reviews of vendors, objects, departments, and funds, that like for the vendors, for instance, I'll be looking for multiple transactions from the vendors where the amounts are right below the official threshold, or anything less than the official threshold that still within a reasonable amount of time sum up to an amount that that would have required bidding or anything else. But then looking at if it's like a legitimate split. So sometimes our splits, and there are prior audit reports that have noted that there can be, quote, splitting, but it's permissible splitting, where it's really between different departments and legitimately between those different departments. So once I get the list of the sort of splits, then looking at if it's permissible or not.
Do you randomly pull a purchase card to a credit card and see how the money's being spent, and if it's being do you do any of that?
I don't plan on doing it per person, but more specifically per the vendor or per the objects, departments, or funds. If I do it per person, then we can start getting into like, is it like confidentiality issues or?
It shouldn't be confidential how the county money's spent on a credit card.
In terms of like how would I report, like it just wasn't on my radar. I can look into how I would structure presenting that, but then like my fear would be, if I'm creating a table and I'm listing out like, the last 3 digits of a card number or the department, somehow there's a little bit of a concern about individuals. I'll have to look at what I can and can't do, what other counties possibly have done for reporting on individuals.
If a county employee has a credit card,
yes,
you should be able to see what they're spending their money on.
Yeah, I will be looking at the per transaction. So, it will be essentially an individual's transaction, but I won't actually be like saying this person looking at all of that one person's transactions. That wasn't the plan. My plan was to look at the transactions that are associated with the specific vendor, because that's where the splitting would happen if it's the end result is that the money's going to that particular vendor or to that particular thing, but that it's on multiple transactions to avoid the bidding process for splitting. The individual, it would be more about like, is it going again to an inappropriate vendor or to an impermissible activity, which would be looking at those objects. If it's going between different funds, then I'll be looking at the funds. But in terms of like looking at the individual, and I can review, you can approach me possibly later for doing an individual review of some sort. It just wasn't part of my plan, because I don't see how a particular, like one person doing something, all the things that a one person could be doing wrong, I would be catching by searching on the vendor or searching on the object or really searching on the two different funds that are possibly being.
But use an example of
Yeah.
a county employee having a credit card. You wouldn't be looking at a vendor saying like a gas station or a restaurant because they're not listed vendors. These restaurants or gas stations or wherever, we had a situation a few years ago where the Board of Ed was spending money at Victoria's Secret. So, I mean, they weren't an approved vendor, but that's where the credit card was being charged at. So, when you maybe I'm mixed up here and confused when you say purchase card. Purchase cards aren't credit cards too? Is that?
No, they are. And Victoria's Secret, when I first create the vendor list, when I see things like Victoria's Secret, I mean, that's obviously going to be one of those things I'm going to look at for like, what are we buying there? So and that goes to that first notion that for me, the vendors is going to be the most important thing to first start looking at, but I'm still going to look at the object class, department, and fund, because I also understand that there's impermissible fund crossing happening possibly, or that's like an area to look at, like between enterprise and non-enterprise funds. But in terms of like, if one person is purchasing at Victoria's Secret and which would be red flagged, and then they're also purchasing at a sporting goods store, a gun store, all these other red flag things, like I would catch those in the vendor. And then that particular person, if there was one particular person who every time I look at these suspicious vendor transactions or whatever, then that would lead us into fraud, which would then be where we would start getting a forensic auditor. My role in the county as the internal auditor is in part to catch fraud, but then when we start getting into fraud examinations, then there would be a forensic auditor, and that forensic auditor would be targeting that one person.
So you're just going to pull a sample. You're not going to look at all the spending. Is that right?
I don't know how large the sample size is going to be. I'm pretty good with a spreadsheet. I'm pretty good with things that are called like pivot tables and VLOOKUPs, which if you're not in Excel, it's not going to like be like, oh, okay, I understand this concept. But I can find split purchases pretty easily. I can find unusual vendors. Obviously, if a gun store or lingerie store or something like that, like I'm going to see that in the vendor list, hopefully. I've already found, I've started, not as part of actually auditing, but I have started looking at some vendor things. And like, for instance, there's a possibility that there are multiple names for the same vendor, and that sort of lets like sort of splitting or impermissible possibly transactions happening, because a purchase could be to one vendor and then to another vendor, and so it looks like, okay, that's not really splitting or somehow avoiding some sort of rule, but it's really one and the same vendor. But in your system, there's multiple names that are for the same vendor, right? Mm-hmm. So I've seen that in Munis already. Mm-hmm. And so I should be able to catch some of these things, and I won't be necessarily looking at every single gas receipt from Exxon, right? So I'm not going to say I'm looking at everything, but when I see multiple vendors with the exact same name, when I see unusual names, if the list of vendors is thousands and thousands, I'm not going to be able to catch every single one. But if the list is only like 1,000, 900 even, it might take me a day or two, but I could possibly look at every single vendor for a sampling to see that, or at least the name of that vendor, that vendor is a legitimate company that we should be conducting business with.
I have a question.
Yes.
When you do the audit, can you catch, I don't know if you look at the budget, do you look at our budget?
That's the plan, yes.
Okay, when you look at our budget, can you find out if people are going over their budget, spending more than they have budgeted?
Yes.
My concern, if they're not following their budget or spending it where they're not supposed to be spending it. That's what I like to see, because we've already approved the budget. And then if they run out of money, we need to know why.
Yes, and that is definitely part of the plan. So that's specifically why number 2 on this list says budget review and audit. The original plan from prior fiscal year that was not done was a budget review, and only a budget review, where we looked at like the inflation rate and so forth. This will be an actual audit where I look at the spending in comparison to the budget.
Any other questions?
I don't want to drag this out, but I got one more question, and this is about procedure. If you have you're contacted either through our hotline or somebody calls you and said, look, this individual's going to, say, an auto parts store, and they're buying parts off the county credit card, and the county doesn't own that kind of vehicle. Okay, so is that when you go to that credit card and you check to see if the county owns that type of vehicle and if those parts were bought for a vehicle that's owned by the county? I'm using an example now. Or do you have to call a fraud auditor to do that?
No, I could look at that, but once I see that there's fraud and substantial, significant fraud, then there's a committee member that he teaches fraud, like his thing is fraud. And I would actually reach out to him about the next steps, because if this was fraud that was going to go to court, then there's all sorts of rules of evidence and so forth. And like, I would want to make sure that I'm doing everything right on my side before we do anything else. And if we get that forensic auditor. So I would reach out to the forensic auditor on the audit committee about next steps once I felt like it was significant fraud.
Investigate it to the point of finding out if it's correct or not, if the report you got was correct.
Yes.
Okay.
Yes.
Thank you.
Questions? Thank you, Ms. Chattel. All those in favor of Resolution 137, 2023, say aye.
Aye.
Opposed? Motion is carried. Resolution passes. Thank you.
Thank you.